your IV. Same thing. It's a tray. Use it as a tray. These from the manufacturer, they suggest that, I'm going to take that off. I usually don't take that off until I'm ready to go, but I want to show you guys a couple things. You have to loosen the needle and the stylet here, and this is a closure device so you don't poke yourself. We're going to pull this out once we get the IV and it automatically locks itself. But you have to pull just a little bit on this white so it comes away from the gray a little bit. And if you see what it does, if the needle's out there, you guys can all see that. Okay, and then when you pull on the white, it pulls the needle back through the catheter. So that just, it's pressurized for safekeeping at the manufacturer, so they suggest that you do that. And I will tell you, I've not done that before and blown a vein because I've tried to pull it out when I'm already in there, and something about the pressure just makes the vein blow. So make sure you do that before, and I usually leave that on there for a minute. Okay, so we decided we're going to use one of these veins over here. So we do our ChloraPrep. You just squeeze it, and you hear the break. The cleaning solution comes on the end. So I think instead of time, they told you like a radius, right, on your videos? Or did they tell you a time to scrub for?
I think it's 30 seconds.
30.
With ChloraPrep, you do like vertical and horizontal.
Okay. So make sure you clean it really well. And once you clean it, don't go back to touching it. Okay? You do not want to clean it and then touch it again. You can touch above, but you don't ever want to touch where you're going to stick the needle. Okay? Because then it's dirty again. All right. So I really want to get one that's going to give me blood, so I'm going to get this one. All right. So clean it. And what's the important part with ChloraPrep to remember? When is it effective? When it dries. So you have to let it dry. So sometimes you just kind of have to stand there and talk to your patient for a second. This is also when I get my dressing ready. Okay. I go ahead and peel it apart and turn it this way. So the sticky side is up. Because what you don't want to do is get your IV, looks great, looks fantastic, and then have to try to open your dressing and your patient moves and dislodges your perfect IV. That's very frustrating. So if you have this ready to go, when you get the IV, you can just turn it over. Okay, so sticky side up, and it's all ready. As if you can tell, the important thing is to just have all of your ducks in a row here. Okay. All right, so this is never going to dry because this is a plastic arm, and it's hot in here. So, up, over, through. And again, just practice on each other. I saw somebody tying it on their own leg, so whatever you want to do is fine. I was like, well, that's very interesting. Okay. All right. So make sure you tell your patient before you actually go to stick them that you're going to stick them, okay? Then whenever you decide which vein you're going to use, you want to take your finger and somehow stabilize that vein. But see, I am above wherever I'm inserting. I do it just a little bit different. Again, it doesn't matter where you hold your hands as long as you stabilize the vein and you're not on the insertion side, okay? I usually hold people back here. I've just found that they don't jerk as bad if I hold them around their arm and I stabilize with my thumb. So it's totally up to you. Whatever you want to do, I'll use my finger. Okay. So I like to start at a very low angle, and here's the reason. You cannot, once you go deeper, you cannot come back. Okay. So if you start shallow and realize you're not in, you can go deeper. But once you go through the vein, you're done. You have to pick a different one. It's all over. Okay, so start very shallow and you can go deeper. And once you get in the vein, you're going to get a flat flashback of blood. Okay, can everybody see that? All right. So what you want to do is advance the wings of the catheter, and you're going to start pulling out on this white part. You're going to start pulling the needle out, okay, as you're going in. Okay, and everybody's going to hear something here real quick. Ready? That is your needle closing. Okay, so you will not stick yourself at this point because your needle is closed. All right, so the pigtail got filled with blood. Do you see that? That's what we want. Okay, this little cap here on the end will not let blood come out as long as it's in there. Okay, even if you're not clamped, you don't want to be clamped when you first start it. You want the blood to come back in your pigtail here. Okay, so You want to flick off the tourniquet before you do anything else. If you flush an arm, if you start this IV and you go to flush it with the tourniquet on, you're going to blow the IV just because of the pressure differences. So make sure you flick off your tourniquet. Take your dressing that you flipped upside down. How you put these dressings on, this little window right here, you want this insertion site right in the middle. So how you get the insertion site right in the middle, you take the wings of your catheter, the blue wings, and you want them to line up with this line right here. And that will perfectly put your insertion site right in the middle of that window. Can you see that? Okay. This little slit right here, your little pigtail goes through perfectly so you can have an occlusive dressing there. So I don't know what your video said at this point, whether you secure the dressing. Right now your IV's pretty secure, but I don't know if I can flush it. I don't know if I can run anything through it. Yes, I have blood, but I don't know if it's any good, right? Before I start securing everything, I flush my IV, because if you spend your time securing it and then you flush it, you have just wasted 5 minutes of your life that you will never get back for something that doesn't even work, okay? All right, so make sure you clamp it, because once you take this off, blood will come back. And then this is where we hook in a reflex cap. Make sure to take off this blue part because we don't need it. Unclamp. Pull back and then flush. They do not want you flushing in the blood arms, so we will not have you flush, but you need to say, I'm going to flush with 3 to 5 mils of saline. So what are we looking for? How do we know if this is any good when we flush? How do we know if it's not good? Any guesses? Anybody had an IV before? It didn't work out for them?
Saline won't go through it.
Saline won't go through? You can't push it maybe? What if you push it and it starts swelling? You get some edema, pain, redness. Sometimes on elderly people, their skin is so fragile